one of the other interesting presentations was actually not in the lung cancer section, but it gave an encouraging potential lead on one of our biggest challenges in lung cancer, and that is KRAS mutations. Overall, they're seen in about 20 to 25% of lung cancer, and we've known about KRAS as a potential target for decades, but we haven't had any effective treatments against it. There was a novel agent from Amgen, AMG 510, that was presented by Dr. Faki and colleagues. This was a phase 1 study that looked at patients with colorectal cancer as well as lung cancer. And this was just a very early study, still trying to find a good dose. The drug was very well tolerated without any significant toxicity challenges. And it had the encouraging signal of treating patients with KRAS G12C mutations, a subset that's about 13% of lung cancer. They treated 10 patients and saw responses in 5 of them. Now, that's obviously not a large study. It's just a very early signal, but how encouraged are you by 5 patients out of 10 for a target that is pretty big in our horizon and has been so elusive up to now? Charu?
Yeah, so I agree with you, Jack, that I don't think we have enough data yet. It's a very small sample size that's being reported on, but I think it's generating excitement, and rightfully so. You know, as you pointed out, KRAS has been elusive as a targetable mutation. I remain skeptical about, you know, these results, and I would certainly like to be proven wrong. But, you know, I think as opposed to your usual oncogene-addicted tumors, KRAS tumors have multiple complex pathways that drive carcinogenesis. So I would imagine that if these responses are seen, presumably they would be short-lived and, you know, quickly overcome by other resistance pathways. So I remain skeptical, but would welcome, you know, further results and would gladly embrace them if these are determined to be positive.
Ben, what did you think? Obviously, this may not have been something that was on many people's radar. It was not highly featured, being just a phase 1 trial outside of the lung cancer session. So I'm not even sure that you had followed it that much, but do you have a sense of this, and what level of optimism do you have about these very preliminary data?
I would say, you know, I'm a little bit more optimistic than Charu. I understand her skepticism. I mean, look, it's only 10 patients. Interestingly, the drug didn't have a lot of activity in KRAS G12C colorectal cancer. It seemed to be preferential for lung cancer in that trial. Look, we've been trying to target this oncogene for forever, and we have historically failed. And this is preliminary data. I think we need to be cautious in its interpretation. You know, it is 10 patients. Every patient seemed to have some tumor shrinkage, but partial responses were only 5 out of 10. So we'll have to see. I think this trial is rolling out. In fact, I just heard at a meeting in Huntington Beach that the trial is so fastly accruing, it's going to close by December. Wow. So we'll get answers soon. We won't have to wait too long to know how these patients are doing.
That's impressive. I was just thinking how nice it'd be for me to direct my patients there, but obviously that window is closing.
You've got 4 months.
Okay.
5 months.
Well, I'm usually as much a pessimist as the next person, but I was prepared to poo-poo the results of an early study, such a handful of patients, but maybe I'm tainted by just impressed by the dire need for something, but I'm genuinely hopeful that 5 out of 10 is the real signal, and it won't end up being 5 out of 70 at the end of this.
So I'm definitely hopeful. I remain skeptical, but don't get me wrong. I would love for this to turn into a real thing.
Sure. There was another study that also, let me just I think my internet may not be as good. Can you hear me okay, folks?
Yes.
Okay, good. So let me just get back.